Good morning, everybody. Pleasingly, 49,000 people came out to get tested in the last 24 hours. Dr. Chant always likes to see that number north of 40,000. We're able to sustain that, but it's so important for all of our community with the mildest of symptoms, or if you're asked to come forward and get tested. That makes sure that we've captured all the potential strains of community transmission. To 8 p.m. yesterday, there were 89 cases of community transmission in New South Wales. 21 of those were infectious in the community, and that's the number that we need to see close to zero. So there were 21 people of that 89 who were infectious in the community, and that is the number we need to get down to as close to zero as possible. Interestingly, more than 3/4 of all of those cases of community transmission were close family contacts. Again, it reinforces the message that every time you risk going outside and doing the wrong thing, you risk bringing the virus home to those you love the most, and that's what the data is telling us. The other area of concern is people who need to leave home for work. If you live in the Fairfield local government area, do not leave your house unless you absolutely have to, and that includes for what is regarded as essential work. If you can work from home, do so. If you can't, and you must leave your home to work, if you live in the local area of the Fairfield local government area, you will need to have regular COVID tests to demonstrate that you are COVID-free, even if you don't have symptoms, because unfortunately we see what we call asymptomatic people. People who don't have symptoms are leaving the house, going out of that local area to work, and unfortunately sending the virus to other parts of Greater Sydney or elsewhere, and that's what we need to stop. So Minister Hazzard did sign a new health order which will ask anybody who works or who leaves the Fairfield local government area for work is tested every 3 days to demonstrate they're negative. But if you happen to have people on your work site, or you happen to have people overseeing work or any type of activity in your private residence or your commercial premises, please ask where they live. And if they live or come from that area, or hotspot area, please ask when the last time was that they got tested. That also will apply to people working in the regions. We will ask people who are working or moving between Greater Metropolitan Sydney and into the regions to get a weekly COVID test, even if they don't have symptoms, just to make sure that we reduce the incidence of essential workers passing on the virus. And we do appreciate that for many citizens, conducting essential work is what all of us rely on, but we just can't afford to have the virus spread through that essential work, and we need to make sure that people keep everybody else free. So the key message is stay home. Do not leave your home unless you absolutely have to. And if you do need to leave your home for essential work, if you live in the Fairfield local government area, please get tested every 3 days, and we're making sure that we make availability of that testing as easy as possible. But I do want to thank the overwhelming majority of our citizens for the work they're doing. We ask people to do a lot. We've asked a lot of people, especially in the southwest, but also in other parts of Sydney. As Dr. Chant will highlight, we have had seeding in other parts of the community. There are other areas now where there are a smattering of cases, and we know how easy it is with the Delta variant, where 2 cases become 20, become 100 very quickly. So we can never ever rest easy until we get that number of infectious in the community. So it was 21 last night. We need to get that as close to zero as possible. And I again want to thank the vast majority of our citizens for doing the right thing. We are in this together, and in the next few days, we want to see those numbers go in the same direction. One day is not a trend. The numbers will keep bouncing around. We have to say that. But I do want everyone to know that our efforts will make a difference. Our efforts will allow us to leave the lockdown in a timely way, but that is dependent on all of us doing the right thing at all times. I'll now ask Dr. Chant to give a health update, and then Deputy Commissioner Warboys will talk about some police operations and obviously answer any of your questions. Thank you.
Thank you, Premier. So New South Wales recorded 89 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. The majority are close contacts and household contacts, but there are some unlinked cases. There were 49,055 tests were reported to 8 p.m. last night. Sadly, a man in his 70s from Sydney's eastern suburbs died yesterday, and he was a confirmed case of COVID-19, and I extend my sympathies to that gentleman's family. Of today's 89 cases, as the Premier has indicated, we had 55 in isolation throughout their infectious period, 6 cases were in isolation for part of their infectious period, and 21 cases were infectious in community, and we were confirming the isolation status for another 14. This is still too many people in the community that are infectious. It is essential that we stay at home and only leave home for the most essential of reasons. And can I just also reiterate, do not visit other family members in other households. The unit we want to keep together is the household. We do not want you inadvertently spreading it to other family members by visiting them. Just as an example, which I think highlights how effectively this virus spreads through households. Of today's almost 60 people, just some examples that we've got one household of 7 people, one household of 5 people, and 5 households of 3 people. So by the time we get to the households, this virus is effectively spread through that household at a very rapid rate. And inevitably, over subsequent days, we'll see those case numbers increase as remaining members of households potentially infected because they've been exposed to their household members. So it does highlight the importance of keeping a household unit together and not moving outside the house and not interacting with others. I would like to just highlight some areas of concern. So whilst the Premier has clearly indicated our focus is on Fairfield local government area, it is critical that we do not become complacent across the rest of Greater Sydney. The risk exists everywhere, and every time someone leaves your house, you have to assume that the person that you may be encountering at the shopping centre has got COVID. So act accordingly. Ensure you are wearing your mask. Shop purposefully. Minimise your time. Put your mask on before you're going into the premises. Ensure you keep your distance and do not interact with others socially in any shopping centres that you're going to. In terms of the areas of concern, and this just highlights that while we've indicated Fairfield, everyone else also needs to remain vigilant. We're concerned about Roselands, Rosebery, Canterbury, Belmore, Sutherland Shire, the St George area, and West Hoxton and Glenfield Green Valley, in addition to Fairfield local government area. So they're the areas we want increased testing. But as I said, those suburbs change day by day, so it is important. This reflects past risk. Every time anyone leaves their home, they should assume that anyone they're interacting with has COVID and act accordingly to protect themselves and their loved ones. Thank you.
Thank you, Dr. Chan. Minister Premier, good morning. 121 infringement notices issued in the last 24 hours. 34 of those were in southwest Sydney. Whilst we would like to see no infringement notices issued, I think people need to take a little bit of heart that police right across the state, and in particularly southwest Sydney, have been speaking to thousands of people as they go about their patrols, whether that be in supermarkets, pulling cars over for a random breath test, or making inquiries as to why they might be in a particular location. This 34 represents, in my view, a considerably good effort by the people of southwest Sydney in identifying the fact that they are serious about the disease, they are serious about complying. And I must say that New South Wales Police Force wants to extend a big thank you to the people of southwest Sydney in the way that they've got into the spirit of the order, that they've complied, and the way that they've interacted with police over the last few days has been exceptional, and we want to thank the people of southwest Sydney. But as Dr. Chant says, that right across this state, that means the rest of those infringement notices were issued in Greater Sydney, they were issued in country locations, north, south and west. And we really want to emphasise that New South Wales Police simply will not put the baton down in terms of enforcing the public health orders right across the state. There are operations, there are taskings, there's information every day that comes out of the Police Operations Centre that operates 24/7 in terms of where we need to be and places we need to go, in particular where people report breaches or alleged breaches on Crime Stoppers, 1-800-333-000. More than half of our work now in terms of COVID-related response comes through Crime Stoppers. I want to also highlight the fact that the QR code or quick response codes are now or should be in operation in every single business and place where people gather and go. We really want people to understand that police will be checking on businesses and places where people are allowed to go. Remember that you can only leave your home for a very good reason. It's quite clear now how you can do that and why you can do that. But if you need to attend a supermarket to gather some essential goods, it is now imperative that you check in with the QR code. Police will be working with small business in particular over the next week to make sure that those codes or that ability to check into a premises is at the front of the premises, is at the point of entry to the premises. And we ask those people to make sure that they also play their part, and that is that those codes are highly visible, that they are easy for people to use in terms of the size of them, the clarity of them, the number of them. The last thing that we want to see is people queuing up to use the QR code. So there's a responsibility there on people and also businesses. The other part that I would really like to highlight is the fact that police are now seeing people congregate in areas where takeaway coffee, takeaway food exists. We had an example recently which highlights this, where people gathered their takeaway goods, moved a short distance away, and then proceeded to hook up a movie on a device and sit there and watch that movie. It has to be understood that takeaway is exactly what it means. That is, you can go to a place, you can buy a takeaway coffee, a drink, a food item, and then you need to leave that location. Police do not want to see people congregating around takeaway food venues. Thank you.
Dr. Chair, can we ask, just in regards to the tragic death, Dr. Chant, do we have any details about the man yet, and do we know if he was vaccinated?
We will report on the cases in due course. Obviously, at this time, our condolences go to the family. Before releasing any information about the case, I prefer to get clearance from the family. It is a difficult time, and that's the respectful thing to do. I can just reinforce the messages in general, which is that the fact that we know that the vaccines, both AstraZeneca and Pfizer, are very effective against hospitalisations. And I would again reiterate my sense of urgency in people to go forth and discuss with their doctor. Anyone over 60, there should be no reason why you do not pick up the phone and get an appointment for your dose. Please discuss it with your GP. And anyone under that, they really need to go forth and have that discussion with their healthcare provider and consider vaccination in this context where we're seeing the risk profile increase.
Could you give us an update, Dr. Chant, on the hospitalisations and the people in ICU? And yesterday you suggested that you might have comorbidities of ICU patients.
So, thank you very much. In terms of I can confirm that there are patients in ICU and young patients for that have no underlying health conditions in ICU. We haven't had the ability to collate that, but in due course, as you're aware, we do report that information fairly transparently in our EPI report, but it hasn't been a priority. We'll get to it, but the key message for the community is young people can get ill and you do not need underlying health conditions. But I am urging everyone over 60 to talk to their GP and look at any opportunity to get vaccinated.
Can you tell us how long ago the man contracted this? There's a case now in Goulburn, so there's a case now in regional area, and then a regional area. How concerned are you that it's now gone to the regions?
Clearly, from the beginning, we were very concerned about the risk of seeding from this outbreak in Sydney, and we've put in protective measures in the regions. So that's why the mask wearing requirements in the regions, the reduced density and the restrictions are in the regions. It's actually to ensure that if we get a seeding event, the risk of it being established in the regions is reduced. But it does highlight why people cannot be complacent about the risk anyway. And I'd also like to say that if anyone is going to the regions for essential work, I remind them that they also need to stay at home. So people are permitted to go to the regions where it is essential for essential work. But if you are doing that, all you can do is do that essential work and go home. You can't go to pubs, clubs, hospitality, anything else. You can only go there and do your essential work and obviously get your essential food and groceries. So the restrictions that apply to you as if you were living in Sydney apply to you when you're in the regions.
Dr. Chang, given the rate of transmission we're seeing...
One case that resulted in 700 here in Sydney. What's the trigger point for a possible lockdown or further restrictions in the regions to hit it on the head?
As you know, we look at the data day by day. We'll certainly be assessing this. I can say that there's widespread testing. This person was infectious at that work site on the 9th of July. We will and was isolating since the 10th. We will certainly rapidly assess the risk around this gentleman in terms of his work colleagues, and that will inform any additional restrictions and advice we need to have in place to actually control any spread.
Dr. Chan, Dr. Chan.
Transmission that we're seeing in households, should close contacts be required to isolate as well?
They are.
They
So
are.
close contacts are required to isolate. This is too infectious, and what the message I'm getting to you is before. It's almost like it's inevitable that it's already spread to the household, and that's why we're trying to get ahead of it. That's why we want to ensure that we have widespread testing in the Fairfield local government area in particular, and even testing when you don't have symptoms. So some of the policy settings where we're saying if you're work outside the local government area, you're now required to have 3 daily tests. The reason for this is that we're wanting to catch people very early in the course of their infection, and hopefully when they're less infectious, so we can intervene, because otherwise it's inevitable that by the time we get to you, you've already infected your family.
Dr. Chan, regarding the Bondi apartment building, how many more cases you had 8 yesterday, how many more cases are linked to that? And do you know how they got COVID there?
So the Eastern Suburbs apartment block, there was 1 further case has been recorded to 8 p.m. last night. So there's 9 cases been identified in recent days across the 5 different households. And I think the key message to us is when you're in apartment buildings, we're not wanting you to congregate in any shared spaces. We've instituted mask wearing requirements for those premises. We understand and respect that they're private premises, but we're really requiring under a public health order that you wear masks when you're transiting through common areas. We're asking people to be very attentive about hand hygiene, mask wearing, and obviously to not go out or be very cautious if they've got to get tested immediately if they've got any symptoms.
On essential work, Dr. Chan, on essential work.
Thanks, Mr. Hazard.
All right. Yep.
When does the public health order for mandatory testing for Fairfield and also for essential workers heading into the region, when does it kick in exactly, and how is it going to be enforced, and what are the exact penalties if people don't comply with it?
The requirements of the new public health orders are aimed at making sure that there's testing of people who are moving into areas outside Greater Sydney, particularly from Fairfield, but everywhere in Greater Sydney. So that we tested. The testing requirement is once every 7 days. People will need to have evidence on themselves to show that if they're stopped by police or other appropriate authorities, that they can give evidence that they have actually had the test in the last 7 days. It's a protective measure, obviously, just aimed at making sure our regions are safe. In regard to people who are currently resident in the local government area of Fairfield, the first message is please don't go outside the Fairfield local government area even if you consider your work is essential, rethink that. But if it really is essential, then you must, if you're leaving, you must have a test every 3 days to be able to again present that evidence. Now, that I signed that order this morning. It starts at 12:01 a.m. Obviously, the police will exercise the same respectful approach in the next few days to making sure that we don't cause people unnecessary problems in needing to get that test immediately, but certainly we'd like it to be done immediately. But the police will exercise judgment, of course, in determining what action they might take if you haven't actually managed to get it in the next 24, 36 hours.
On essential work, I'd like to ask you this, but also maybe Dr. Chart would be able to answer it as well. As you'd be aware, there's no definition of what is and isn't essential work, at least for Greater Sydney in the public health order. You're talking a lot about people needing to leave the house for essential work. Will you define what is and isn't essential work, and can you send a message on what is essential and what isn't essential?
Look, we've indicated, James, you've asked that question in regard to what is essential jobbing, what is essential work a number of times, and what we've indicated is that to try and define that is very challenging. But I think in terms of essential work, the employer and the employee would know whether that particular worker was essential to the particular circumstances. And so it will be left to the worker and to the employer. But my message also to the employers particularly is, if you don't need to have someone come from an area that is suspect and obviously has major COVID concerns presently, then perhaps it might be an idea to make arrangements for a worker from another area. You can spend your lives looking for loopholes in these things and look for reasons to duck and weave, but the answer is use common sense and work with the public health officials to try and achieve what we need to achieve. I'm sorry, let me just finish, James. Thank you, James. What needs to be done here is to apply some common sense, and if you really don't need to leave your area, particularly in Fairfield, don't leave. And I want to emphasise, it's more than that. It's absolutely stay at home and don't spread the virus to either your workmates or your family.
I understand. I mean, it's creating a fair amount of confusion, though.
Sorry, James.
I would suggest it's creating a fair amount of confusion, though, Minister. I mean, the Mayor of Goulburn understands that this positive case who was working on the redevelopment of the hospital was a painter. Now, he would suggest that it may not be essential to get a painter from Greater Sydney to come and do that work, but he's allowed to under the health orders. So would it not be a way to reduce confusion by defining what is and isn't essential work, considering you keep talking about essential work?
As I said, it's practically very challenging, and with the greatest of respect, I'll take my advice from the epidemiologists and the public health officials who are giving us that advice.
Health experts in Melbourne have been saying overnight that if Sydney doesn't go into, something equivalent to the strictest of rules that we saw in Melbourne last year during their lockdown, we could face a lockdown running out until Christmas. What do you say to that sort of analysis?
Look, nearly 19 months in, we've had to listen to an array of experts, in inverted commas, with not seeing the data, not seeing the information that we have. They're entitled, we're in a democracy, they can give us the benefit of their wisdom, and we certainly listen, but the people that we listen to most and form our views on are the public health officials, Dr. Chant and her team, and I'll rely on them.
Every 3 days, they're going to have to isolate until the... No, that's not correct.
No, this is a protective measure. They won't have to isolate. It's a measure just to go and get the test. Obviously, if it turns out to be positive, well, our public health officials will be in contact with them almost immediately, and they will then do what everybody else has had to do with that. Sorry, just let me finish, guys. Seriously, just let me finish, please. Well, no problems if the Premier wants to answer it, but...
That'll create some confusion. So if someone in that LGA goes and gets a test, the usual requirement is they need to isolate until the result is received. So they will not need to do that?
No, they will need to do it every 3 days, and if you had them sitting at home waiting for the test results, then obviously that would not be a practical measure. This is a practical step. They can have their test every 3 days. Dr. Chan, would you like to clarify it for us? Because there's a lot of enthusiasm heading on both directions.
Look, I think one of the issues is we've got to remember that a lot of workers support aged care. Look, I can talk from my perspective of what I see as critical. We need to have health workers deliver health services. That's essential. We need to have aged care workers care for our elderly. We have to balance having no workforce to do that against what's pragmatic. Now, we do a lot of surveillance testing, so just to be clear, surveillance testing is a concept that I think the community understands. We've talked about it in the context of quarantine, where our workers undergo surveillance testing and they don't need to isolate. So our quarantine workers undergo daily salivary testing and when they're at work, and what we're doing is basically instituting surveillance testing. Now, the group that are anyone with symptoms, that means you have symptoms, however mild, you need to isolate until you get a negative test. And also, what we're actually asking the community to do is, if at all possible, defer going to any workplaces, even if it's essential, if it's not going to impact on those critical services, and await for your negative test. So this is about balancing competing risks and benefits, but we urge the communities that I've read out, and I know our strong focus is on Fairfield, but I'm also urging all of the people in those other suburbs I'd rung out to also please come forward for testing at this time. It's important we don't just think the risk exists in one area. What we need to do is see behaviour change across our population, work together to support our response to COVID. And as I said, assume every time you're going out of the house, you could be coming in contact with someone who's infectious. I've told you today that over 21 infectious cases in the community. That's probably going to be much higher when we look at those 14 number under investigation, read their isolation status. It is incredibly critical that those individuals could be anywhere across Sydney, Greater Sydney and the region. So please act in accordance with what we're asking you to do. Only go to work if it is the most essential, and please stay at home and do not visit family members.
If I could just again reiterate what Minister Hazzard and Dr. Chant has said, anybody with symptoms should not be doing anything apart from getting a test and staying at home. But through the abundance of caution, if you're an essential worker, leaving Fairfield local government area or leaving Sydney and going to the regions and have no symptoms, we still want you to get tested in case you have the virus and don't have symptoms. So this surveillance testing that Dr. Chant refers to is only for people who don't have symptoms, because if you have symptoms, you should go nowhere apart from a test and inside your home and isolate. So I just want to be very clear that this additional testing is what we call surveillance testing. It means for people who don't have symptoms, who may not even have any symptoms whatsoever, but it's an extra degree of caution to make sure that people unknowingly don't spread the virus, and that's the difference. But please know, if you have the mildest of symptoms, even a scratchy throat, get tested and stay home and follow the health advice, and we can't be stronger than that in the advice.
Given the size of the vaccine hub that's going to open in Fairfield, the Mayor there says that it should be open for more than a couple of weeks and that it should be expanded beyond those priority groups that you went up. Is that something that is feasible given supply issues?
With all due respect, a lot of people will have opinions about what needs to happen with the vaccine rollout. That's why it's really important for us to listen to the experts and to implement our policy as we see best under the circumstances. So please know, as I said yesterday, we're putting up pop-up vaccination centres where they're needed. If there's a hotspot in another local government area in the future, we'll have the capacity to do that. And obviously our priority is to make sure we minimise the spread and have an eye to what life will look like once we exit the lockdown. And that's why we're preparing for that by making sure those categories of priority workers or categories of age or vulnerable people have access to the vaccine. Obviously, if we had unlimited doses of the vaccine, we'd be able to do more. But at this stage, we're making sure we provide the vaccine to those who most need it, in those areas that are most needed. And I'm pleased to say the New South Wales health system itself we'll have a capacity in due course of up to 200,000 jabs a week, and the GP network obviously is also increasing their doses. And I again want to thank the GP network and the pharmacists who will enthusiastically be administering vaccines throughout the state in the very near future. And I want to thank everybody supporting our efforts, the New South Wales government efforts, and obviously the federal government's rollout strategy.
Will you now commit to making all teachers a vaccine priority when you have the supply?
Well, what we need to do is make sure that we provide the vaccines to those priority communities. But obviously, if you have an unlimited supply of the vaccine, once we get doses rolling through, well, obviously then you can provide greater coverage to greater numbers of workers and greater numbers of the community who are vulnerable. And also I appreciate how young people want to get vaccinated, and there's nothing stopping a young person from getting the AstraZeneca vaccine, but please go through your GP at this stage to make sure that any health issues are covered off. But once we get greater doses of the vaccine, which we're expecting towards middle to end of September, that will allow us to provide greater coverage over a greater number of areas. But what we need to do in the meantime is take the health advice on what the key priorities are, what the key areas are, and that's what we're doing.
In regards to lockdown, Premier, you've made it clear that it's likely to continue, but what day this week will you actually make an announcement, and then will it be open-ended?
Yeah, can I say that I'm hoping to make an announcement today or Thursday at the latest in relation to the future of the lockdown. And can I for a second pause and thank all the mums and dads who are at home and support, and the teachers and the students who are homeschooling from today. I know what a big sacrifice that is and what a challenge it is for many families and school communities, and I just wanted to acknowledge and thank everybody for that. We will, of course, as a government, take the health experts' advice on what we announce as the next stage of the lockdown beyond Friday. And as I've said before, as Dr. Chant has said and the Minister has said, I'd love to have a crystal ball to say exactly when the end date will be. That's up to all of us in part. When we get that 21 number of at least 21 people who've been infectious in the community, as close to zero as possible is when we'll be able to exit the lockdown, and that's the target we need to aim for. We're not looking at the overall number of cases, although that's very important for us to understand, what the virus is doing. But the number that we really worry about are the number of people walking around in the community with the virus. And unless that gets down to zero or close to zero, we can't get out of the lockdown. And that's why it's important for all of us to know that our actions can impact others. Because if we have information that there's people with the virus that have been in the community, that means chains of transmission could exist we don't know about. And again, I've said this a few times, but I just want to stress to everybody at home, this Delta variant, as we call it, this variant of the virus has a life of its own. It's more contagious, it moves around in different ways than we've ever seen before. And in the Australian context, we're learning a lot as to what it does, and it is a very transmissible virus. And so, for example, previously, whether it was the Crossroads cluster or the Avalon cluster, because it was a different strain of the virus, we were able to do things differently. We were able to lift the lockdown after a certain stage. We were able to limit it to a certain part of Sydney. But because this is so transmissible, the risk is so much greater, and that's why we're treating this lockdown, that's why we're treating this virus differently, because it's a game changer. It's very different to what we've seen before, which is why we have to treat it differently. You can't really compare the way we're dealing with it now to previous strains, because they've had a different result and a different impact.
Premier, there's a school in Chester Hill, close to Fairfield, that's requiring all students tomorrow to attend to do HSC trials. Is that something that concerns you?
Well, can I just give a huge shout out to the New South Wales Education Department for their outstanding work, and they've been working closely with the Catholic schools and also the independent schools. We know that the Education Department, in consultation with Health, are making special provisions for HSC students, and I think all of us would understand and accept that. So Health and Education have been working very closely together to make sure that Year 12 students and their families are supported during this time. And I have confidence that education and health, in working together, will be able to provide that necessary support to reduce stress and also to ensure that there's as little distraction or as little disruption as possible for those undertaking Year 12, especially those who need to do practical or oral assignments which require different aspects of face-to-face. So we know that in some circumstances that's being allowed, but it's done with the very strictest of health guidelines and with the very strictest of cooperation with those schools and New South Wales Health. I'll go here and then there, yeah.
Are you happy with the federal support package, and can you give more details about the support that's coming for
I
business
hope
and casuals?
the Prime Minister, the New South Wales Treasurer and I hope to give details of that later today, so we'll have plenty to say then.
Why do you feel the need to reach out to prominent people in the business community to use their international contacts in a bid to get more vaccine doses? Is that an indication that the federal government wasn't doing enough to get vaccine doses for New South Wales?
Oh, look, I don't really want to comment on that apart from saying that the New South Wales government always works really hard in the interest of our citizens, and I'll just leave it at that.
Yeah. Lots of South West Sydney kids are still being sent to school because they are the children of essential workers. One principal is saying that they just need help defining essential. Schools don't understand. Teachers don't understand, and there are still kids coming in, and there's a lot of concern. What do you say to those
Oh,
schools?
look, I say to people with those type of questions, please look at what we did last time. There are very vulnerable children in very special circumstances which require that attendance, and health is putting in place and has put in place provisions to make sure the virus doesn't spread through those means. But we have to accept that some children are in very vulnerable situations, and last time as well they were being supported through the school community, and health has put in special measures for those circumstances.
Dr. Chan, have you been made aware of the case of Sydney nurse Maddie Morris? She went public with her story on 2GB radio this morning. Essentially, she's a nurse. Her husband was in a horrible car accident. She provides care for him, but she's now been told she cannot access him and is seeking an exemption from the Western Sydney Health District. Have you been made aware of that case, and can you do anything to assist her so that she can be with her husband?
These decisions around access are made through the local health district, and so I think it's most appropriate that we leave those issues should be resolved given the specifics of each case. Just to reassure the community that there are risk assessment processes put in place and some protections to facilitate access to your loved ones in those sort of very special circumstances. So I'd be happy to look into that.
Dr. Chan, yesterday you mentioned about the people going into GP clinics who were infectious, into medical clinics. Do you think there's an argument at this stage to start talking about home testing?
So we have got an array of testing options. So we've certainly been working with our GPs to encourage, messaging to their patient groups about ringing first before they come in, making sure that people are assessed and do video or telehealth consults, and then arrange appropriate testing. So there's a range of drive-through, and access to testing in that Fairfield local government area is extensive. We're doing more. Every day we've opened additional sites in conjunction with the private sector to really make sure that there is no barrier to testing in that area.
No home testing though?
There are home testing available, but if you're wanting to look at large numbers and ease, it's about giving people a variety of testing options, and obviously we'd like to keep any home testing for the most vulnerable, people that are bed-bound, people that actually can't get out, whereas those people who are happy to access drive-through is very popular in the area, but there are a range of testing options, and I would urge everyone to go to the website and look at that, because we have established some new testing options for the community.
Dr. Chan, can I just ask, there's a letter from a group of doctors recommending that masks be made mandatory outdoors, and also that after getting the AstraZeneca vaccine, that the second one is a Pfizer vaccine. Is that something you'd consider or being discussed?
At the moment, there are constrained supplies of Pfizer, so I think we've made it clear that we're working in a supply constraint for Pfizer. The evidence about the second dose of AstraZeneca is that the side effect profile from the second dose is very much reduced. 1 in a million, 2 in a million. We're talking about a very remote risk of the rare clotting disorder. And so the best thing people can do is, if you've had your first dose of AstraZeneca, please talk to your GP about bringing that dose potentially forward to 6 to 8 weeks. And in some circumstances, a GP may recommend an earlier point at 4 weeks. We know the AstraZeneca is very good, just as the Pfizer is, on protecting against hospitalisations. So I would urge people, at the moment, the best priority we can have is vaccinating with the AstraZeneca, and I would urge anyone over 60 to please book in for their AstraZeneca. And I appreciate the assistance of the GPs. I had a discussion with them last night, a number of them, and I want to thank them for making more bookings available to improve access to AstraZeneca at this time to meet that need. But the GPs will have to prioritise, and it is reasonable that they prioritise their more elderly patients at this time.
Dr. Chan.
Would you consider a short, sharp lockdown for certain communities where a case pops up, given the state is so large, so not to disadvantage all communities?
Look, we always follow the health advice, but I think what's happened in Goulburn is a good example as to why restrictions exist in our regional communities. It's so that if there is a case, the restrictions prevent what we call a super spreading event. And that is the whole reason why we've asked all of regional New South Wales to make that sacrifice. And I think people in our regional communities get it, and they are the first ones to defend their communities, and we want to thank them for their patience and their understanding, but also that any decisions now or into the future are based on the health advice, and that's why we have those measures in place. But please, can I reiterate Dr. Chan's comments? If you are an essential worker going outside of Sydney into those regional communities, firstly, you'll need to undertake a weekly test. If you don't have, obviously, if you've got symptoms, you shouldn't be leaving your house. But if you must go to work, you must make sure that you have a weekly test. And also, you are bound by the stay-at-home rules in Sydney. If you need to leave, and that goes for people who might live on the boundaries, you might only be leaving your house for 50 kilometres or 20 kilometres, but if you live in a stay-at-home area, you are required to obey those rules even when you're working. So you can't just go in and sit down and have a drink or have a meal in the regions. If you are under the stay-at-home orders, you have to treat that community in that same way.
Essential workers who live outside of Fairfield but are going into Fairfield to work, are they subject to this new health order?
Well, we wouldn't recommend that at all. We're asking people to stay at home unless they absolutely have to. But clearly, if you have to do essential work into the local government area of Fairfield, obviously you need to take those extra precautions. We would prefer people not go there unless they absolutely have to, not undertake essential work unless they absolutely have to, and they're the rules.
Premier, what sort of developments have been made towards mRNA vaccine production in New South Wales? Have there been any changes, and in particular for booster shots going into next year? Yeah,
well, certainly in terms of manufacturing mRNA vaccinations in New South Wales, can I thank the universities and our chief scientists who've been working on those opportunities, and I am getting regular updates from them, and as soon as we have any major developments, I'd be happy to convey that to the community. But we know that these needs won't stop even when COVID stops. We have to anticipate and assume that we may need these vaccinations in the future, and I would like New South Wales to build the capacity to have an unlimited supply moving forward, which is why I want to thank our chief scientists and a number of people across government who are working with the university sector and others to bring that to fruition in New South Wales.
Dr. James touched on Mr. Hazard before. I can't imagine for a second, I don't want to put words in your mouth, but you wouldn't define a construction worker travelling from Sydney to Goulburn as essential. I don't think any person in this group would do the same thing either. Is the difficulty providing a legal, legislative definition of essential, or is it a reluctance from you in terms of for economic reasons?
It is so difficult. As Minister Hazard has said, it is so difficult to have a precise rule for every single thing. That's why we rely on common sense. We rely on people to respect the intent of the health orders as well as the letter of the health orders. And rather than looking for loopholes, we say to everybody, stay at home, unless you absolutely have to leave for work or essential shopping, and there's rules around all those things. This is a time where everybody has to exercise their common sense, but also the person receiving the service. If you have people coming onto your commercial premises or residential premises from any area undertaking any type of work, ask them where they're from. And if they're from a hotspot area, ask them when the last time was they got a negative test. This is about all of us working together to get those numbers down, especially in relation to the number of infectious people in the community. And we've seen that when you try and get so technical, there are always going to be exceptions. People will always think they can cut corners, and that's what we're asking people not to do. In addition to the health orders, exercise good common sense, exercise good judgment, exercise extra caution, and be kind and thoughtful to your fellow citizens. That is as important as respecting the letter of the law. It's actually having that extra degree of common sense and kindness and thoughtfulness for fellow citizens. I'm sorry, I didn't hear.
Will New South Wales proceed with the international students pilot, or is that now on hold as a result of this?
Well, obviously, we will look at all those issues once we exit the lockdown. So whilst we're in lockdown, our absolute obsession is to get us out of lockdown. And we all know the challenge that poses, but know that by working together we will get there. And so we won't do anything as a government to compromise our ability to exit the lockdown as quickly as we can. But once we exit the lockdown, we will look forward to all those opportunities that are presented.
So it could be paused.
I'm sorry?
It could be paused depending on how things go.
Yeah.
Is there an exemption for workers to visit the regions, President? Do workers have exemptions to visit the regions if they deem it essential for themselves?
Well, obviously, sorry, just the rescue helicopter. Can you guys hear me okay if I still speak? Okay. Well, obviously there are always exceptional cases where people need to work in the regions. You might be living on the outskirts of metropolitan Sydney and attend to an essential workplace, whether it's a health precinct, whether it's other, logistics and delivery. There are certain things all of us need to keep society going, and that's why it's really difficult to have one black and white rule. But that's why we want people not just to respect the letter of the law, but use their common sense as well.
Banning all travel regardless of essential or not.
That would be impossible. People have to, regrettably, this is a time when, heaven forbid, an immediate family member may pass away. There are always compassionate reasons why people do need to go outside of their region. I think the helicopter stopped us today. Thanks, everybody.